Hi friends, Grace here, and I'm talking today about no-shows, cancellations, and it all goes back to accountability. One of the things that I've been really thinking about lately is always leadership, always accountability, always training. I think a lot of times we think that patients miss their appointments because they don't value us, because they think other things are more important. We've got all these theories, and I think all of them, bring a little bit of validity, but I think we're missing the big point as to why patients cancel, no show. It starts with ownership of your practice and your systems, and knowing that it's your responsibility to address this and to fix this. There are some practices and teams out there that have almost 100%. I mean, people have emergencies and they miss and things happen, but at the end of the day, there are practices that have very low no-show cancellation rates. And that starts with the doctor owner realizing that this is my responsibility to address this problem, to prevent it, and how am I going to do it, and coming up with a set system. So a couple things here. Now, when we're talking about managing teams and leadership with teams, we're talking about one level of leadership, right from the doctor owner to the team member. So this could be, delegating tasks, implementing accountability, things of that nature, one level. When you're talking about diminishing no-shows and last-minute cancellations, you're actually talking about two levels of leadership. So now you're not just going direct from doctor communication to patient, you're going from doctor to team to patient. So your accountability and your training actually has to go from you to your team. And a lot of times when I talk on these kind of things, doctors will say, well, we don't have time for that. And my answer is, well, then you need to get someone in there that can create this accountability and training for your team. And you can't stop at training. Training is completely worthless if you don't have accountability. So even if you took the time to bring your team to a CE event where they learned about how to create this accountability, what verbiage to use to decrease and diminish no-shows and last-minute cancellations, none of that matters if you don't have accountability. And it's up to you. The team needs structure. The team needs accountability. They'll function, they'll be happier, and they'll be better at their position if they have it. So true accountability is super important. Training matters. It's only as valuable as the accountability that you implement. So that's tip number one, is actually look at what is being said from your patients, from your team to your patients on a daily basis, what verbiage is being used to schedule and confirm appointments, and how are you going to hold the team accountable, meaning how are you going to spot check? How are you going to evaluate the occasional conversation and call and rate it so that you can say, yes, so-and-so is following these systems. If not, I promise you, even the best teams are going to slip until they have that accountability. So embrace the fact that as the owner, it's your responsibility to implement accountability. And if you don't have the time or the knowledge on how to do that, you need to work with someone who does. So a few ways to implement that accountability would be pulling calls and listening to calls on occasion and making sure that the verbiage is being followed. If you do have a script, you want people to just stick to the script. Just do it the way you've been trained to do it, right? We start having people that come in, and they come in with past experiences, maybe habits that aren't the same as how you want things done. You've got to kind of be able to hear that and remind them of what's important and have a regular conversation as to how you want it done. If the team knows that you're going to be spot checking, listening to calls, and you've got a method for that, they're going to pick up and adopt your not even recommendations, but your way of doing things a lot quicker. So one, have a way of doing things. Two, train the team to do it that way. Three, have true accountability, pull phone calls, give feedback on these things so that the team knows that it's not just a suggestion. Because without accountability, everything that you recommend is just a suggestion, and it doesn't necessarily change how people do things. Next, show it, don't just say it. So anytime you can show instead of tell, or show and tell, you need to show it. So you need to have a visual that you can hand to patients when they're scheduling, letting them know of your cancellation policy. The next tip is don't forget to have why you have that cancellation policy. Most people are good, inherently good people, and those are the kind of people that you want as patients in your practice, good people. So if you express to them that, I'm not sure what's going on here with my camera, but if you express to patients why you have this cancellation policy, meaning we are having the team here for you, we've reserved our time exclusively for you, and in order to operate in a way that we can stay in business and serve our patients, we need to be able to count on you to be at this appointment. That is going to leave more of an impression than this is our policy. We need 48 hours or we're going to charge you. When you explain why, you connect with people on a human level and they'll actually care about you and your time commitment. So that's super important. Another thing is tip number 4 is realize that karma is a thing. And let me see. Oh, I'm running late for my podcast. Penny Reed, if you're watching, I think you're watching. I'll be there in 1 minute. I'm so sorry. So the next thing is karma is a thing in business. And so if you are that doctor that's taking last minute vacations, moving patients around constantly, canceling on them, they're going to think that your time is flexible. So if you put out to the universe that you can cancel on them and you can move them and you can run late and you can make them wait an hour, they're going to treat you the same way. So we've actually trained people through our actions, through our words, how to treat us. So you've got to really be intentional about how you train your patients to treat you. And number 5, my last tip is be consistent. What happens if you don't show for a hotel reservation? You still get charged for it. So be consistent with how you handle these situations and make sure that your quality of care is high, that patients feel super important when they are in your practice, and that way they will value being a part of your practice. And when they do not show last minute or whatever it may be, have a system that you follow. If it's a true emergency, have them send you documentation so that you can waive the cancellation fee. Even with employees, people who miss last minute, things like that, you want the employees in your practice to give you documentation that an emergency really did happen. That's just part of protocol in running a business. You can do the same thing with your patients. You can say, I am so sorry to hear that happened to you. I would be happy to waive this cancellation fee. I would just need documentation. So if you could fax that over to me or text that over to me or email that over to me, I'd be happy to get this taken care of for you right away. And really communicate on a level with your patients that you care about them and you're on their side and you want to make this right for them. So there's ways to do this, but we've got to have the right verbal skills and accountability in order to train our patients on how to respect our time and our business and our team. So I hope this information was helpful for you. If you want to add information to this, please just comment below. And if you're joining in just now, go back and watch the whole video because I think it's great information. So you guys have a great day. Thanks so much for being a part of the group. And if this video brought value to you and it's going to, initiate some change in your practice, please send some dentists to our group so that we can continue to grow our influence. Thank you. Have a great day.